Dr. Carlo Biasucci here for Northern Dental Care, and today I want to cover a topic that we get questions about all the time, and that's why are my teeth sensitive? There's actually many reasons why teeth can be sensitive, so it's useful to go through some of that, hopefully help to answer some of your questions. So one of the things that people will say when patients come to see us is when I bite on something, particularly hard foods, I get a little twinge, or I just get outright pain, or my tooth aches for a few seconds and then it sort of lingers and it goes away. What typically is happening there, we can see here on the upper left photo, here's a filling, an older white filling, and we can start to see where it's breaking down where the filling meets the tooth, and there's actually some breaks in the filling itself. So we can see that there's some leakage around the filling, and same thing with this metal filling here. We can see darkness around the filling, so there's some leakage around the filling. What happens in these cases, if we look at the upper left to the picture directly right of it, if we take the filling out and we explore it, we can actually see what the green circle is denoting here. There is a crack line that runs right along the inside of this tooth. So that means if we go back to this picture, when a person's biting with food in the middle of this tooth, this part of the tooth right here is actually moving a little bit, and that crack line is setting off the nerve of the tooth and you're getting pain. Same thing with the tooth below, same idea. Filling removed here in this photo, you can see again a crack line that runs right along here. So this piece of tooth, when a person's biting with food, is actually moving just a little bit, enough to cause pain. Here's another example, exactly the same thing. So older metal fillings break down where the filling meets the tooth, which you can see here, darkness, breaks in the filling. When the person's biting with these particular teeth, you'll get some discomfort. Sometimes you do and sometimes you don't. It's not a guarantee that this situation always causes pain on biting, but typically if there's pain on biting, this is what we find. So again here, if we've removed these fillings, we can see very clear crack lines within the tooth. So what can you do in this case? Typically after we've removed the filling and we've seen what the problem is, we'll refill the tooth and we'll look at an option called a crown. Crown is basically a cap or a shell of porcelain that fits right over top of the tooth. So what we would do here, you can see in this schematic, if we were to reduce the outside of the tooth like you see right here, take an impression of the tooth and then make a porcelain crown, cement right on the tooth, and then the tooth is covered and protected. So in this example here, we would reduce the outside of the tooth, particularly where it's cracked, make a porcelain cap, and it would hold the entire tooth together. The tooth looks just like a normal tooth, but it's much stronger. There are some circumstances where if this crack goes too deep into the tooth, gets too close to the nerve, that the tooth may need root canal treatment regardless of what you do, but that's probably only about 10% of cases. There's another scenario that causes tooth sensitivity, and if we look a little more closely at the way this particular example, the teeth on the upper are sort of tipped inward. What happens is there's a mismatch in the bite, and the forces on biting or clenching or grinding of the teeth cause some flexing of the upper teeth against the lower teeth. And how that plays out is you get these little notches that take place here right at the gum line. And these areas where the enamel chips away, not due to toothbrushing or any other abrasive cause. This is pretty much entirely due to the way the teeth fit together. And because of that, the lower teeth bumping into the upper teeth, causing flexure of the tooth, the enamel chips away right at the gum line because the root is then stuck in the bone, so it's solid there, and there's just a minute flexure of the tooth, just enough to cause the enamel to chip away. And that exposes the inner part of the tooth. So you have the sensitive part of the tooth no longer covered by enamel, and now cold and sweet and brushing, sometimes even just breathing the cool air from outside is enough to cause sensitivity in these areas. So what can we do about that? There are a few options. The most basic would be using a desensitizing toothpaste, Sensodyne being the most common brand, but most brands out there, Colgate makes a sensitive toothpaste. I believe that all the manufacturers make a sensitive toothpaste. That's your first step. If that doesn't give you enough relief, what we typically will do next is place a desensitizing material on the teeth. And if that doesn't do it, then the next step would be to actually place a filling in these areas. And the filling is not like a traditional filling. We don't have to drill into the tooth or anything like that. There's no cavity to remove. We're just replacing missing tooth structure. So we can actually just place that right over top, often without even freezing the tooth. And that will act as a thermal barrier and take away most of the sensitivity. Of course, if we address the way the teeth fit together, that will go away as well. Let's look at another example. Very similar, but we have some really deep areas in the molars. So really deep notches here. Where you see these dark spots here, this is actually where, right to the nerve of the tooth, the nerve is actually receded away from these areas. So, we really do want to place some filling material in these areas to cover up this part of the exposed root of the tooth, because if you get a cavity here, which you'd be more prone to, you can really have problems quickly because you're right at the nerve of the tooth. And obviously these areas would be quite sensitive. So we would freeze them, we'd place a filling over top of the tooth, and odds are they'd be fine for a while. Some of the more minor areas here would be just little simple fillings, and some of these areas we may not need to do anything. So that sort of covers the general range of why your teeth could be sensitive and what we can do about it. If you have further questions, do give us a call or speak to your dentist.